Our next presentation is going to be from South Metro Health Service, so Fiona Stanley Fremantle Hospital Group, Sally Hassan, and then from Rockingham Hospital, Kate Marwood. So take it away.
This one. Cool. Hi everyone, my name's Sally. I'm the grad coordinator in the really bright lights. I'm the coordinator for Fiona Stanley and Fremantle Hospital. Thanks for coming along today. Fiona Stanley Fremantle Hospital sit under the South Metropolitan Health Service, so SMHS. So I'll talk for a little while and then my colleague at Rockingham, Kate, will talk after that. So we'll get started. So I'd like to respectfully acknowledge the past, present and emerging leaders of the traditional lands on which we're standing. It's a privilege to be standing on their country. So basically, I have to stay here, don't I? Right here? Okay, so you're coming to apply for a grad program with us, but it might be, just so that you know, our grad program is informed by our strategic intentions. The strategic intentions of Fiona Stanley Freo are to provide excellent healthcare every time for every patient. It also talks about providing a vibrant workplace for our staff, focusing on research, focusing on leadership, focusing on excellence in providing clinical care. So when we create and adapt the grad program, this is the stuff that we're referring to. So when you work for us, this is the culture that we are asking you to work within and supporting you to do so. And so from that, there's just the pillars of care that we will work towards. Just a bit of background information if you want to look it up. It'll be available on our websites. Okay, so what is our program? It's called Nurture Nursing Transition to Practice. So basically, we have the pools. So we've got registered nurse pools, enrolled nurse pools, midwifery pool. We do a SMHS mental health pool that we share with Rockingham. And then, like Charlie's, we're going to offer a theatres pool this year for the first time. So when you're applying, you'll have that theatre option as well. And then I'll just move on from that, sorry. Okay, so basically, Fiona Stanley Fremantle, we have one program across two sites. So when you apply to our pools, you're applying to go to either Fremantle or Fiona Stanley, dependent on where we can place you. They're 12-month contracts. Currently, you would work the equivalent of about 9 shifts in a fortnight, although we have just taken on a small group like Charlie's had of 6 shifts in a fortnight. But generally speaking, the pools that you're thinking of applying to at the moment are 9 shifts in a fortnight. 12-month contract, one program, 2 hospitals. So some things are going to be similar across the hospitals, overarching things, and then there'll be different idiosyncrasies, obviously, with each site. The joint aspects are that when you start, you'll come and do your orientation and induction at Fiona Stanley Hospital. And then from that'll be first and second day. Your third day, you'd go to your local area for orientation, whichever ward, whichever hospital you're going to. And then as part of our program, we have 5 study days. 3 of those are predetermined. So you would come back to Fiona Stanley to attend those study days. And then the other 2 are elective, if you want to call them that. So you might have a different interest somewhere else that you'd like to do a supernumerary day, or you might like to shadow a clinical nurse specialist, or there's lots of different options, and you would negotiate that with your area NUM and clinical educator or staff development nurse as you got down the track, probably in your second 6 months. Also, we have graduate coaches across both hospitals at the beginning. Okay, so study days. I think I've covered most of this. So you get 5 study days, 3 predetermined. The predetermined, they're a matter of consolidating some of the skills. So for the people who started in February this year, they've already attended essential skills. So that was more about revisiting assessment of the systems, A to E, There was also talking about blood transfusions, talking about cardiology aspects, things like that. And then when you do those on the first and second study days, the third study day is thinking about what are you going to do next with nursing? Like, how are you going to use the skills, draw from the experiences that you've already had, and then use them to apply, because we also offer a re-employment process at the end of your first year. So what do you need to do to get through our grad program? Well, this makes it sound like we're quite harsh, but we're actually not harsh, but strict, but we're pretty flexible. I'm about as soft as they come. So you have to work a minimum of 56 hours a fortnight. So this equates to about 7 shifts in a fortnight. But generally when you're applying to a full-time job. And then if you'd like to go part-time, we'll do that through negotiation. If you have a need to work part-time, which I'm sure many of you do, wherever possible, I would encourage you, at least for the first 2 or 3 months, to work full-time, just so you can consolidate your learning, get your time management down a little bit, just orientate yourself to the area, find your groove, and then step down if you need to. We can support you doing that. Also, we would like you to attend all 3 study days. We're able to. We will get you to do professional development reviews at 3 months and at 9 months. So at those points, because when you're first starting out, like, what do you want to achieve? Where do you think you want to go? What skills do you want to get down in your first 3 months? And then what do you want to get down towards the end of your year? So we use that to help you guide and reflect on what you're doing and what you're achieving and where you'd like to move to. We have a competency framework, so we call it Chapter 2, and basically it's a workbook full of different skills. So initially it's providing character care, so care for the patient, and then it sort of starts to break down into medication administration, caring for catheters, caring for the deceased patient, all those kinds of things. So every grad that comes will work through that book. I think we're saying now about 3 months you'll get through that book, 3 to 4, depending on how you work and where you work. And so that way everyone who comes has got the same sort of skills. And then if you decide if you're going to an area that has other things, other skills, then we've got different core skills that we can also have against you. So then as you move around the hospital, if someone's like, say, I wonder if they can do this, we can look it up and you'll be recorded as having that skill. So that's a really encouraging thing that we've developed. The other thing is, as part of the grad program, probably in the second 6 months, we'll get you to do a quality improvement reflection, which means you'd participate in an audit and then you just do a really brief reflection. And of course I say all this, but I have to put in the fine clause that things might change because of COVID. Last year, because of COVID, there was one study today we couldn't run just because of proximity. But yeah, we'll adapt as we need to. So graduate re-employment. So this is what I'm working through at the moment with all the people who started in August 2020. So we have a re-employment process towards the end of the 12 months. So basically we ask you to rank the 3 areas that you'd most like to work in, and then we contact the NUMs, the nurse unit managers, and then we ask them if they can take you on, and if not, then we'll go to the second preference and we'll do that sort of stuff. So this is part of the grad program in your first year that we offer this service. And if you're not successful, there's plenty of other ways that we can support you. But if we've got anything to be grateful to COVID about as a healthcare worker, there is work to be found. So Fiona Stanley, we have the RN, the EN, the Midwifery and the SMHS Mental Health and now the Theatres program. Each one of those pools or specialties has its own professional development pathway. So you do a local orientation, you do a learning map, you do your PDRs and then your framework. And so when you're at Fiona Stanley, some areas will have 2 placements, 2 6-month placements, and some will have 1. The reason for that is that some areas you can use the full 12 months to learn the skills, whereas in other areas you'll move around and develop skills across 2 areas. So I say all this with the understanding that we are looking at revamping our program. So this is what is historically, this is what we've done, this is what we're doing at the moment, but we may well change that as well, because we're starting to look into how can we support you in doing more postgrad studies once you get through your first year. So in doing that, it might require changes to what you do in your first year. So this is all the specialties that you can see. So at the moment, where it says peri-op and imaging, so theatre and PACU, or theatre and recovery, that's what would go to, that was what you're really keen on, you would apply for theatres, the theatres pool there. So then you go to FREO, RNs, ENs, the SMARS mental health, and we'll do the theatre program there as well in the FREO theatres because they're just getting busier and busier. We've opened lots more beds at FREO in the last couple of weeks, taken on lots of extra staff. If you're placed at Fremantle, at this stage you will do 2 6-month placements. And has the same learning pathways, packages, all that kind of thing. And then if you're at FREO, you're going to end up doing 2 of 3. So you'll have surgical, medical, mental health. You'll do 2 of those. And that's the FREO ones there. So just a little bit about the SMARS mental health program. So Rockingham, Fiona Stanley and Fremantle recruit to that. You'll apply to that SMARS pool. And then if we're going to take you to interview, we'll probably give you a quick call to find out what your preference of hospital is, and whichever hospital you prefer, that's where we'll do your interview, and wherever possible, we'll place you at Freo, Fiona Stanley or at Rockingham. So it's a 12-month program. We do it in conjunction with Notre Dame Uni, and you begin your graduate certificate. So we will pay for you to complete 2 units at university. And then this will set you up so that if you want to go on and do further studies, you can pay for your own studies in the 2nd year. So with that program, you get 2 weeks consolidation of mental health studies at the beginning of your grad program before everyone else. So you really get 1 year in 2 weeks, if that makes sense. You do your 2 weeks, then you do induction orientation with everyone else, and then you'll have predetermined mental health study days. I think that's that one. And then, of course, we've got our maternity program. So maternity, I can't pretend to be a midwife, but there's the obstetrics ward, birth suite, prenatal clinic and MAFAL, so the assessment unit. You'll get 6 study days, and they are obviously very midwifery, maternity focused, lots of hands-on support, lots of senior nurses around. Now's the time to be a midwife. We're really wanting to recruit midwives, so a good time to apply for our pool there. So graduate support. So what do you get when you sign up with us? So you get me and you get my colleague. My role, as well as facilitating the program, is to be your advocate. So basically, you guys as nurses are the advocates for the patients. As a grad coordinator, I'm the advocate for you. So that's a main part of my role. You also have the nurse unit managers on the areas that you're in, the clinical nurse educators. If you're at Fiona Stanley, the educators on the ward are called clinical nurse educators. If you're at Freo, they're called staff development nurses. They essentially do the same thing. And then because those guys are only able to work Monday to Friday morning shifts, we also have grad coaches for the first 6 weeks. So they'll work after hours on weekends in the afternoons to support you while you find your feet. They'll move around between the wards at Fremantle and between the wards at Fiona Stanley. Just so you know that every ward that takes grads has an educator assigned to it. Have I got time for questions? No time for questions. Feel free to ask afterwards.
You've left me 5 minutes. Oh, sorry. She's left me 5 minutes, so hopefully we'll be fine. So I'm Kate Marwood. I'm the graduate program coordinator from Rockingham, Rockingham Peel Group. Let's get this thing to work. So Rockingham Peel Group is, the Peel part is from the mental health community that we have in Mandurah, and the Community Mental Health Service and Murray District Hospital, which is down in Pinjarra, just a little bit south of Mandurah. So our graduate programs, we've got registered nurses, registered midwives, enrolled nurses, and the SMARS mental health program, as Sally's described. So we take 20 currently, I can't say how long this will go on for, 24 registered nurses, up to 4 midwives, 4 enrolled nurses, and then we take 2 for the SMARS mental health program. We've got the RM program. Currently their intakes are February and August. The midwives is February and August, and enrolled nurses, as I stand here at the moment, it's August, but that could change, and then the SMHS mental health program in February and August. So the SMHS mental health program, it's 10 shifts a fortnight, and for enrolled nurses and registered nurses, it's 8 shifts a fortnight. We did that so it would allow us to take more registered nurses, sorry. And the midwives, they can be up to 10 if they wish. We can negotiate down if you want to do less than 8 shifts, but I don't think that much less than 7, you're not going to be at work often enough to actually consolidate what you're doing, but we can negotiate. And there's always extra shifts. If you think you want to work full-time, there is always extra shifts. I can guarantee you that. Study days, the RNs have about 9, as they do the ENs. And because we're very generous to our midwives, they get 15. And Sally's explained the SMHS mental health program. So our rotations are the aged care services, which is the aged care unit and Murray District Hospital. So you do 3 months in Murray District and 3 months in aged care rehab. And that is just for 2 people they do that, and then another person will spend 6 months in ACRO. People wrinkle their nose at ACRO, but because we're a smaller hospital, we actually have more services within each ward. So it's actually, there's a lot more to it than just aged care rehab. Surgical services is multi-stay surgical and day procedure. There again, if you choose, elect to go there or prefer to go there, you'll actually have 3 months in day procedure and 3 months in multi-stay surgical. Mental health is a first rotation placement of 6 months, and then we add in ED, ICU, medical assessment unit, and paediatrics and theatre in the second rotation as the critical care areas for the RNs. ENs, we're a bit limited. We've only got aged care rehab, medical ward, mental health and multi-stay surgical. But what I try to do is mix that up a little bit. So if you go to aged care rehab, I try to avoid sending you to somewhere like medical because they're very similar. So I try to give you a broader range of experiences. In our mental health program, you get exposed to all areas, adult open, older adult, and there is a little bit of time out in the community. Midwifery, go everywhere. Birth suite, wards, visiting midwifery service, antenatal clinic, neonatal nursery and the assessment area. So our requirements, attending all the study days, completion of our graduate program workbook, which is very similar to the book that you get from they have at Fiona Stanley. Quality improvement activity and presentation, but not for the enrolled nurses at this time. And they have enrolled nurses do a case study presentation and lots of reflection and goal setting with your staff development nurse. So Sally's talked through that. So any questions we'll come to a bit later on. Thanks.